I'm Jennifer Shea here for a special edition of Ask the Medical Director. We have Dr. Brian Gooley, the toxicology fellow, with us today to talk about xylazine. Dr. Gooley, could you tell us a little bit about yourself?
Yeah, so I actually started as an EMS provider. I was a EMT basic. I trained not far from here, and then I practiced a little bit of, I was a firefighter in Bemidji. Afterwards, I got into medical school, and that was in MCW in Milwaukee. And I stayed there for residency for emergency medicine. And afterwards, I got into toxicology. So I do a little bit of both right now. I do a little bit of emergency medicine and toxicology at both Regions and HCMC.
Oh, how interesting. We're here today to talk about the drug xylazine. We've started to see this at Regions, and we wanted to learn a little bit more from Dr. Gooley.
Yeah, so xylazine has been around for a while. It's been used as a tranquilizer for veterinary purposes and not human purposes, and that's because you get pretty significant hypotension from xylazine. It kind of works you can think of it the opposite way from epinephrine. I think a lot of people have experience with using epinephrine, and xylazine will work at kind of toning down the sympathetic nervous system. It'll kind of cause a decrease in their mental state. It can be only mild, or it can be quite severe. It can cause a decrease in your heart rate and your blood pressure. And so this has kind of made a resurgence as somewhat of an adulterant in some of our usual street drugs, including fentanyl and cocaine. In fact, sometimes it's an intentional part of cocaine, and they use it as a speedball when it's combined with maybe another opioid. On the street, I think they call it trank. That's what you might hear it referred to if it's xylazine alone.
Okay, that's helpful. And when did you start seeing this recently on the street in St. Paul?
So it's tough to say because we don't have a specific test for xylazine. People will come in and they'll have this kind of syndrome of being very sleepy, and they'll be bradycardic, and they'll have hypotension. And a number of drugs can cause this, and we don't test specifically for xylazine. It's probably been around for some time, and so it's very hard to track in that regard.
Okay. Okay. And so you were talking a little bit about when they mix it with other drugs. Tell me what that would be like when you mixed a stimulant and the xylazine. What might a patient present like?
So xylazine itself, if you had it alone, can look very much like an opioid overdose. They can have myotic pupils or very small pupils. Again, they can be very depressed mental status. And if you mix it with methamphetamine or cocaine, you can think of those as uppers. They kind of increase your awareness, increase your stimulation, and give you an increased heart rate and blood pressure. If you mix that in some amount with xylazine, you'll get somewhere in between, maybe emphasis on the methamphetamine side if there's more of that in the drug, or maybe more of the depressant side if xylazine is more prevalent.
So very unpredictable.
It's really quite unpredictable. Yeah, it's hard to guess at it, I guess.
Okay.
Yeah.
Okay. And so then the next natural question would be, what about Narcan?
And that's a good question, because Narcan works great, as we know, for opioids and shouldn't work for xylazine. But here's the trouble. On the street and in the emergency department, you're not going to know if you have an opioid overdose or if you have a xylazine overdose or if you have a combination of both. So if you have someone who's sleepy with small pupils, you might as well try Narcan, because if it is opioids, it's likely to be reversed. If there's some component of xylazine in there, maybe it won't be reversed completely, or maybe not at all. But I wouldn't say you should withhold it if they have the clinical syndrome that looks like opioid overdose. Now, if you give a dose per your protocols and it doesn't work, or they don't respond, redosing may not be necessary for those patients.
So the Narcan is going to have no effect on the xylazine?
Xylazine should not be affected by Narcan.
Okay. What would xylazine look like isolated?
Isolated, xylazine is likely not to take the form of a pill. However, illicit pill manufacturers do exist. So it's hard to kind of say exactly what it would look like. I don't think it would have any striking difference that you would be able to tell that from methamphetamine from heroin if you just had the substance available to you.
Oh, okay. Okay. And who's mixing this in? This is getting mixed in at the manufacturer level, or is the xylazine getting mixed in on the street?
That's another great question. There are reports that xylazine can cause a different high when used with heroin, and so it may be an intended effect to be combined with heroin, which would suggest that it's made at the manufacturing level.
Okay.
However, it's hard to know, again, exactly where the xylazine is making it into the supply, because we don't really have access to that.
Good information. One last thought. How would the presence of xylazine affect your assessment and treatments as an EMS provider? What would you like EMS providers to know or do differently because of this information?
And that's a key question, because ultimately, if there's a patient in front of you who's obtunded and they have very low ability to clear their airway or maintain their airway, that should be your primary concern. If you can avoid an intubation by giving some Narcan, that's wonderful. If they don't respond to the Narcan, then it's back to ABCs, and I know all of our EMS providers know how to do that very well. Mm-hmm. If we manage the airway, we manage the breathing, we manage the circulation, getting them to the hospital is the top priority. And with xylazine, that's really no exception. You know how to manage people who have a depressed mental state. You know how to manage people who have a low blood pressure. All of these critical care procedures that we do every day work great for xylazine as well.
Good, good. And is there a concern about becoming hyperthermic with this drug at all?
That would be less of a concern. Hyperthermia is something that you would expect from some of those methamphetamine or cocaine, and those additives, or I guess the things that xylazine adulterates.
Okay, okay. One last thought. Where are EMS providers likely to see you?
Yeah, so you may see me in the emergency room. I do take a number of shifts at the United Emergency Room if you make it there, or you'll see toxicology staff in the Regions Emergency Department all the time. We consult on just about all of the toxic ingestions that make it through the ED there, and then follow them once they're on the floor. So I think that it's a great way for us to interface if we get some information from you, and then perhaps we can provide some insight onto those medications.
This is great information, and I'm sure the providers will appreciate it. And thank you so much for your time and coming over.
Yeah, no problem.